Hey guys, and welcome back to my channel. So today's video is going to be a little different. What I'm going to do is just kind of go over what evidence-based birth is with you, because I just recently started taking a class called evidence-based birth, and I just want to kind of go over what evidence-based birth is with you guys and then why you should care. So this is especially going to be relevant for expectant mothers, but if you're planning on having kids in the future, then this might be relevant for you as well. So, the definition of evidence-based birth is accurate information about the pros and cons of different options so you can make an informed decision. So, it's not just like if you were to just think of evidence-based, you would think, oh, it's just based on research, but it also lists the pros and the cons of everything involved with the decision, and in this case with labor, so that you as the person going through it can make an informed decision. So to go along with that, a little further definition, there's 3 tiers to evidence-based birth, and the first tier is based on research evidence. So yes, most of what they go over in the class and what you learn is based on studies, research studies that have been conducted, so that you can have good evidence in the future. The second tier is the care provider who stays up to date on evidence, and in that case it's important to be your own advocate, because evidence takes roughly around 15 to 20 years to get from the research study to the hospital. So if your healthcare provider is not up to date on their research, then you need to advocate for yourself and ask questions. Then the third tier is your goals, your values, and your preferences. Without this, evidence just becomes like a bad dictator, because you don't want to make a decision solely based on research. You want to make it based on your goals and how you feel about it. So ultimately, you should be the final decision maker of what happens to your baby and your body. So hence the evidence-based birth part. Like I said before, research is often 15 to 20 years behind. So that's a big gap if you think about it. A lot of the stuff that they make you do in the hospital is kind of out of date, and they really don't know why they do it. For example, one of the articles we read this week was on eating and drinking during labor, and it all started in the 1940s when they used to use like narcotics or chloroform or things like that to give to pregnant women during labor to ease the pain, because if you ate while taking those drugs, you would most definitely throw up. So that whole concept in general is a little out of date, and it's good to know that you do have the option. If you want to, you can totally eat and drink during labor. There's nothing wrong with that. So it's just good to know the pros and the cons of things like that. And a big thing about evidence-based care is it focuses more on preventative care than reactive care. So a lot of the care you receive in the hospital during labor is completely reactive. They're just reacting to the situation, making decisions based on what's happening in the moment. But evidence-based care does the research ahead of time and runs all the tests ahead of time to make sure that that stuff doesn't happen, so you can be more proactive about it. And there's also a big part of evidence-based care is there's a ton of pain management techniques that you can do during labor that do not involve drugs, that do not involve, plugging yourself into machines, that really do help a lot with the pain during labor, but they're not even brought up or suggested. So instead of suffering through the whole long labor, especially because you can't even get the epidural until you're dilated so many centimeters, there's a lot of things you can do up until that time to manage the pain. And then there's also research involved in the evidence-based care regarding the pros and the cons of medical pain management. So what happens when you do receive an epidural? What does that do to your body? What does that do to your baby? Okay, maybe you don't want an epidural, but you want something else through the IV or through some other drug, because they do have other options out there. But what does that do to the baby? What does that do to you? So it's good to know that going into the situation so that you can make an informed decision. And a big thing here also is that when you go into labor, doctors are usually on a time schedule, and they want to get that baby out as fast as possible. And they will do whatever that needs to be done to get the baby out as fast as possible. So sometimes that can rush labor, cause more pain and more permanent damage than if they would have just been patient and waited for the process. And the biggest thing here is during this whole time, you need to feel like you're in control. So if the doctor rushes in and starts doing all these things, you need to feel like you're in control and that you know what's going on. And another big thing that people kind of overlook is that giving birth is a natural process. It's not a medical condition. You are not sick when you go into the hospital in labor. You are going through a natural process, giving birth to your child. So they should not treat you like you are sick, unless of course you are a high-risk pregnancy. But if you're a low-risk pregnancy, there's nothing wrong with you. You're just naturally giving birth. So they should not treat you like you are a sick person. And the biggest reason I wanted to join this class is because you should be informed, and it's important to do your research before going into, labor, into the situation, so that you make the best decision to fit your goals and that you are the most comfortable. Because if you're not comfortable, you actually go into like a fight or flight mode when you get into the hospital, and that can actually shut down labor. So you need to feel like you're in control of the situation, that yes, although it may be painful and it may be long, that there's ways to get through it and smoother and with the least amount of damage afterwards, if that makes sense. So there's just a lot that goes into it, and I'm really excited to take this class because this is just the first week. So this is kind of just what we've covered in the first week, but we're gonna go into, like I said, pain management techniques, birthing plans, all types of things. So if you're interested in learning more about that, just let me know, and I'd be happy to share another video. But I got most of this information from the website, which is evidencebasedcare.com. So if you're interested in learning more about that, I'll drop the link below for you guys. But if you have any questions at all, feel free to reach out to me, and I'm really excited to share this journey with you guys. Have a great day.